Integrative therapy is therapy designed to integrate, firstly, different methods or approaches to psychotherapy, and secondly, to integrate different aspects of yourself or different parts of the self, really. It's about integrating your life, work and play, your body and mind, and we do that by using different kinds of psychotherapy. Some of them focus on the body, some of them focus on the mind, some of them focus on the past, some of them focus on the future. We're trying to pull it all together to make a complete, unified life for you. Well, integrative therapy is whenever you take two methods or more methods and put them together in a principled way. There's eclectic therapy, which is about just taking techniques from all over the place. Integrative therapy is about trying to think of a way to put these two or more methods together. And of course, there are as many different ways of integrating as there are different methods. But the best way, from my opinion, to integrate is to try and achieve a unification. And the way we unify things is we try and understand the underlying principles and bring them together so that we can do psychodynamic techniques and cognitive behavioral techniques and systemic techniques from a same underlying unified perspective. Integrative therapy requires more knowledge and skill than knowledge in any one area, in my opinion. You need to be able to understand, as a therapist, two or more ways of doing psychotherapy. And you need to have thought things through so that they really integrate well. So the disadvantage is that you have to find somebody who actually can integrate psychotherapies, and you have to ensure that the person who's doing the work can convey a unified idea of what they're doing. Well, often people have got more than one problem, and integrative therapy works well when people have got several problems. So they might have some physical illness that they're dealing with. They might have habits that they want to change. They may have relationships that are not working well for them, and they may be in a difficult position in their organization. If they've got all these problems to solve, it's useful to use an integrative therapist, because the integrative therapist can see which problem to tackle in which order, and can see how different techniques can combine usefully to solve all the problems in the right sequence. If you're a person who likes some aspects of several different kinds of psychotherapy, but you don't want to miss out on other aspects which that psychotherapy doesn't use, then it can be useful to go for an integrative therapist. So you might be interested in the rationality and evidence base for cognitive behavioral therapy, but you might be more interested in the drama and story of the psychodynamic therapy. So what we're trying to do is integrate those different aspects. We want to have drama and story, but we also want to have rationality and evidence. I would say look for somebody who is not just eclectic in the techniques that they gather, who has a defined interest in integrative therapy and seems to have thought it through. Many people would say that they use many different techniques, but an integrative therapist is very interested in putting those different techniques together in an explicit and organized way to create a complete and fulfilled result.